There are three words that no one wants to ever hear: that you have cancer. Recent statistics are showing the fact that more than 40% of the current population of the world will hear this sentence at some point in their lives. That means one person per every household. But there are some good news in the field of cancer therapy as well, like the fact that we have more than 20 different drugs for each type of cancer in average. But if that's the case, what makes it so difficult to cure the cancer and save people's life? Today, when a patient is diagnosed with cancer, the oncologist would simply assign one major form of treatment, only depending on the type of the cancer. However, if the first cycle of chemotherapy doesn't work, which it doesn't for more than 80% of the cases, the oncologist has to assign additional rounds of treatments each time with a new drug. These additional rounds will keep going until they get some response from the patient's body or the patient passes away. The difficulty of choosing correct form of treatment right at the beginning is simply because of two major factors. First is the genetic variation between the people, and second is because of the differences between the tumor's properties even with the same type of cancer. This is exactly where my project steps in. The current method is more like a trial and error, so they have to wait for at least 3 months to see if the initial decision in choosing this method of treatment was correct for this patient or no. This makes the whole process of chemotherapy very long, up to years. And that means the patient is under a lot of unnecessary pain, and the chance of treating the patient would become lower and lower because the tumor might progress, might spread all over the body, or might become more and more resistant to additional chemotherapy. With my system, after the biopsy is done and it is confirmed that the patient has a cancer, we can use the biopsy tissues, which is a sample from the tumor, to use the cancer cells from it. Then we can put those cancer cells in my device, which is mimicking the body. So we can give the cells whatever they need to keep growing. After only 1 week, we will have a lot of tiny tumors, exactly similar to what patient has in his or her body. Then we can apply all the possible treatments to see which one works the best for this particular patient. Not only that, we can apply them against healthy cells to see the side effects of each treatment. Moreover, we can give some idea to the oncologist about overdose or low overdose level. Together, we want to show that cancer is just a word, not a sentence for your life. Thank you.